Hello and welcome to Differential Discussions. I'm Melissa,
And I'm Dave.
and we're back with another synovial fluid.
Joints, 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 more joints.
Mhm.
Always joints. They never stop.
Yep.
Um, yeah, so I'm a little excited about this slide already.
I feel like
Because I
it's a little
think,
bit junkier than the other
yeah,
ones that we've looked at so far.
yeah, it does look like there's a bunch of schmutz.
Mm.
Um, and that's not, body fluids can be kind of messy. So you
Well,
just got to kind of
especially
roll with it.
joints, I feel like, because once you add in the hyaluronic acid,
Yep.
you kind of get,
Depending
or
depending what you
hyaluronics.
use to put that in there.
Yeah.
So once upon a time, we would use wooden applicator sticks, and you can get some of the wood debris in there and see the plant cells and stuff like that. And while fun and a change of pace, it's noise, right? So
It's not fun in a joint to see plant cells. All right. Well, let's scan around.
yeah, you see a little bit of nucleated cells, a little bit of red cells, it appears. Excuse me. And some clumping, right? Some kind of clumping clusters of cells and stuff. I'll think, oh, yeah. So like I like when I see things like this. Um yeah. I don't want to like get ahead of the morphological I oftentimes irresponsibly make calls on really low power. But the fact that they're in such close proximity to one another, I feel like my intuition is that they're going to be our lining cells.
Mm,
But
there's a good
yeah,
chance. Let's finish our scan just so we can see
yeah,
all this crap.
100%. So I see a lot of like mononuclear looking cells, right? Like,
Yeah.
so many of our other synovial joints fluids we looked at, basically neutrophils have been like the predominant cells. Holy clump of cells, Batman.
Yeah, and I mean, if we see like big, ugly, dark clumps like this, or this one here,
Mm-hmm.
we might automatically start thinking about malignancy.
Yep.
But again, we're looking at a synovial, so malignancy is not the first thing my mind goes to. I'm thinking more there's probably a bunch of clumpy lining cells around somewhere.
Yep. Yeah, when the clinician is inserting a needle into the joint space, you can take some of that tissue with you.
Yeah, the tissue surrounding the synovium,
Yep. Yep.
their lining cells,
Yep.
which look just like mesothelial cells, but because
Yeah.
it's a different body cavity, it's
Yep.
not a mesothelial cell.
Different call. Yeah, it's a different function, although similar, right?
Yes.
They're you know, they're like cousins of one another, I would say, but still different enough. The main difference being that these particular cells secrete the hyaluronic acid, which is that lubricant for the joint.
Mhm. Yes. But it's all thick and gooey, so when we try to look at it,
Yeah,
it's
it's
not
kind of like maple syrup kind of consistency,
like a thick maple syrup.
and
If you've
and
ever
then
had a watery
stringy.
maple syrup, it's not a watery one, it's a
True,
thicker one.
true, true, true. Yep, yep.
All right, so I'm gonna go back over here because I felt like there's a pretty good distribution. We're gonna ignore the giant clump, but
Yes,
I want to start with the cells around it.
sounds
Or do you
good.
want me to go back? Actually, let's go back and let me see if I can find the clump. Hmm. I don't
Hmm.
see the clump that you pointed out, but
This one looks pretty interesting.
we can go with
Uh,
this one here.
right above. Yeah. Oh yeah, 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 yeah. Center field. Perfect.
this clump. Ooh, they're beautiful.
Absolutely beautiful, stunning.
All right, I'm gonna drop down to 100.
Yeah,
I'm
I
not gonna
agree.
bother on 40, but beautiful. Oh crap! Come back. Me and my big fingers hitting the stage.
Perfect.
Is that good on the light?
Looks great to me. Yep. So where do we begin, huh? Um, so I think when I was learning, I had it mesothelial specifically described to me as like a fried egg appearance, and I see a little bit of that in in this. Now, because of the it's literally the joint being that it's a joint means it can't be a mesothelial cell, right? But how nicely round the nuclei are, even yeah, yeah, these are beautiful. Something that Melissa's pointed out in a previous video too. So this one doesn't have buddies stuck to it, but look at the bumpy kind of edges to it, right? So
Oh, sorry, I
um
moved it as you tried
no,
to
no, no.
grab it.
No, yeah, no worries. So like if you were perhaps debating, is this a monomac or is this a lining cell? Those lumpy bumpies to me is definitively that it's probably a lining cell. You can actually see that it was kind of ripped away from whatever its neighboring tissue cell was. So I 100% would call that a lining cell. Other things to address too. Typically, when you have nucleoli, right? Multiple nucleoli, we think of like kind of scary stuff. Tissue lining cells are very metabolically active. It's not going to be uncommon to have sort of a lacy, the pattern doesn't look super mature. That's okay. That's how it'll always look. That's the forever look for these cells.
Yeah, and that'll take time. So if you're doing a body fluid diff and you come across one of these and you're like, oh, it's okay to ask somebody with more experience. So don't feel bad asking. Ask until you're comfortable. Body
Yeah,
fluids are challenging.
yeah, definitely. I agree.
Let's move around a little bit.
Beautiful.
What's it?
So we're seeing what looked like quite a bit of
Yeah.
line. Yeah, good. So differing people may have differing opinions. It happens, right? But if I had to make calls here, right? You said, Dave, you have to tell me what you think. I would think that this cell down here would go into my mono category, monomac, whatever the institution uses. And I'd probably the rest of these fellas I would do as lining cells. I'm not quite sure what's going on here. It's hard for me to see if there's cytoplasm.
Yeah, I can't tell if
Yeah.
there's cytoplasm either.
That one's a little tricky for me. So I might take a pass on that one and just consider it smudged. And then in the corner here, I see what looks like a lymph.
Yeah.
High NC ratio, not a lot of cytoplasm. What's there is like a light blue. Looks like a lymph to me. What you'll notice about synovial lining cells is they typically are very, very basophilic. They have that rich blue cytoplasm. This one is like a good color.
But this one's nice because you can see like the fried egg really well.
I agree. Yeah. Beautiful. So just how round that is, and it's just like, and it's centered, right? Which is it's like for the most part, right? It's getting pushed a little bit, but yeah, that just screams lining cell to me.
And then we have a bunch of dead space.
So now don't get me wrong now. So one of the other challenges with fluids like this is if there are lining cells actively shedding into the body fluid space, as lining cells start to degenerate, they can look a lot like monomacs. So I think that that can be kind of tricky. How beautiful, right? So now this looks like a continuous sheet
Yes.
of lining cells. So we can see little, what we might call windows, right? I'm going to draw some lines here. Some of them are a little bit easier to see than others. But those windows is totally normal and expected.
Yep. And it makes sense that if you see lining cells, thinking about you're inserting a needle into a joint, and what you're doing is sort of ripping that lining to get the needle in, and you're having those lining cells slough off. So it makes sense that they would slough off in kind of a clump like this rather than, I mean, you get the individual ones too, like we've seen, but a lot of times they slough off in sheets or clumps.
Yep, 100%.
And
Yeah,
I think,
I think it happens more in traumatic taps. So
yes,
like maybe it's a very difficult tap. It's tough because I'm not in the room to correlate the experience, right? So a lot of this is just intuition. So take this with a grain of salt. But there are also inflammatory conditions where you'll see a lot of lining cells, but there's individuals, right? Like that can happen as well.
well, and with the
I'm not.
inflammatory conditions, a lot of time they are really basophilic, like
Yes.
scarily basophilic, and
Yep.
then they're more of reactive looking lining cells.
Yep. 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 100%.
I think this is more of a like a monomac.
100% agree. I agree.
So you have a
And
nice
and,
contrast here.
there is a nice contrast there. One thing I would note too is this one has kind of a shaggy cytoplasm. And like, I'm sorry that our heuristic, our little rule, doesn't always neatly translate. But I think the big signal there is what Melissa pointed out, is that differential color is quite the contrast, you know. So yeah, I would like macrophage on that cell.
Oh, we're gonna ignore this giant clump of stuff.
Beautiful. See, lining cells just look pretty to me too. Like this cell is gorgeous. My terrible arrow. And then I think this one's a lining cell too. That's
Yeah,
just seen better days.
agreed.
And
I
then
don't
I'm
really see the
unsure.
cytoplasm for this one again.
Yeah. So I get very you will see smudge and like nuclei, just like low nuclei, pretty often in body fluids. So I really have to definitively see a cytoplasm before I want to make a call.
Agreed.
Ooh.
All in the field. Oh, I got them all in the field. Hooray.
Yeah. So this is perfect. So this appears to be a lymphocyte to me.
Yeah.
I have a nuclei and I have a little bit of cytoplasm. Most of it is hard to see, but I can see this, and that's good enough for me. Straight line. And then down in the corner here, there's a little bump over there. I'm gonna get all those notes out of the way. That to me looks like a really good like monomac kind of cell. And then a beautiful lining cell with our lumpy bumpy kind of exterior.
Levy.
So yeah, blebby. Yep. So this might be a good one for our audience to maybe take a screenshot of. It's a good kind of contrast.
Yeah, I think too, we don't talk as much about nuclear chromatin patterns when we talk about body fluids, but if you look at even just the nucleus, the lining cell is more roundish ovoid, and that mono is almost like a, not even like ovoid, it's like oval, but then with that little indent in there, and it's
Yep.
they're both eccentrically placed, but it's distinct shape patterns, and then the cytoplasm here again kind of has that almost like gritty, junky, beaten up appearance to it, whereas this is pretty and blebby.
Mm-hmm. Yeah, I think that's actually worth mentioning too, because we go on and on and on about chromatin pattern, right? So if we had a counter for how many times we said it in our videos, it would be up there. Chromatin pattern is almost like not as important in body fluids a lot of times. I think because of the process of the cytospin.
Yeah.
It's like less useful. But with on that note, though, I would say this looks like a lymph chromatin pattern in a body fluid, sort of, right? I don't know if that makes sense to you, but
It does, especially because what you're doing is you're smoshing the cells
Mhm.
onto this glass with the cytospin. So the cells spread a little bit more.
Mhm.
So one, you see more nucleoli in body fluids than you do in peripheral bloods. And they're not abnormal. It's just these normal cells that have nucleoli that hide them. But now we're seeing them a little bit more prominently because of the squishing.
Yeah, and doesn't that's like where a lot of my anxiety, if I think back, like
Yeah.
cells look so scary in body fluids.
Especially
They just
limbs.
yeah.
Not these limbs, but some limbs will be like, bam, giant nucleoli.
Yep. And once you start looking at tumor cells more and more often, then you start to see like, okay, when it's bad, so to
Yes.
speak. But okay, this is cool. So I'm gonna guess like this looks like a lining cell.
Yeah.
This looks like a lining cell.
Mhm.
And then I'm kind of like on the fence about this one, but that oval kind of makes me think monomac. How do you feel about it?
Also, this grittiness here.
Seeing some texture, right? Some
Yeah. Mhm.
so our monocytes have like granulation and stuff, right?
And it's also less fluffy and light like this guy here. It's almost more of like beat up.
It's the chromatin. Here I go. The, the chromatin pattern is more condensed too,
It is.
which I see as a contrast. So like I generally expect synovial like lining cells will have a fairly monotonous, repetitive kind of patterns between all the cells.
Mm,
So I see direct contrast like that as like
yeah.
somewhat of a clue. Body fluids are tricky.
They're challenging.
I love them personally, but see, now I'm gonna eat my words because this in particular, the
Oh,
darkness of that to me screams lining cell.
let me try to, because I really want all of these. There we go.
Oh my goodness. Yeah, this is a challenge,
Yeah.
right? So, oh
Okay,
my goodness.
so my opinions. I'll
Yeah,
start.
please.
I'll go with my thoughts. This looks like a lining cell.
Yeah, agreed.
Flebby, super round nucleus. And then because of this one looks like a monomac.
Mm.
Even though it's dark, because we can also have reactive histiocytes or
No,
reactive.
that's a great point. So monocytes, macrophages, they can get really mad. And then that causes them to, I don't know what the science is, make stuff, and that stuff is blue.
Well, the
And
more
so,
basophilic you
yeah,
are, typically more RNA or more proteins you're making. So it makes sense that when monos get angry and they're responding, right? Because their job is to respond to stimuli,
yeah,
that they'd start making more stuff. And so they would
yep,
get more basophilic.
yep. So my guess is too that that nucleus shape is playing a big role for you, right? Yep.
The nuclear shape and also the not the chromatin but the cytoplasm looks very different from this cell that we're looking at and saying that's a lining cell.
Fair enough. Yeah. Mm-hmm.
It almost looks really granular, but I
Mm.
don't think it's granular. I think it's just the grittiness to the cytoplasm. I
Mm-hmm.
mean, it is granular, but not like super granular. It just is really gritty in the way that it's making everything. So between the
Mm.
cytoplasm and the chromatin and the nuclear shape, because I looked at this, so this field is tricky, right? You look at the field and you're like, oh my God. What you do is you look at the cell and you go, I know that's a lining cell.
Mm-hmm. Mm-hmm.
And then from
You
there,
can
you
use it.
compare everything to the one you know.
Yep. Yep. And then use it as it's like a calibration, right?
Yeah.
Like yeah. And give yourself and us, please, a little bit of grace. There's some of these are just like really tricky calls. I'll most often the hardest calls are clinically irrelevant.
Yeah.
So um But now, what do you say?
About this guy.
Yeah.
He's the javelin, right?
Yeah. I'm sort of like inclined to say macrophage.
I'm looking at the cytoplasm and what it's doing, and I think it's a macrophage.
Yeah. Yeah.
Also, the nucleus isn't quite as nice as the lining cell that's there.
Yeah. Yeah. The NC ratio kind of like is a kind of thing for me that I can't get away from. So that's interesting. So we have a couple of monomax, right? We have the one lining cell here. And then these are kind of tricky too. So my thoughts here is that this is just a really crappy looking lining cell. um, the nucleus to me kind of tells me that. I have a little bit of that tearing on the back edge here, and I'll get those out of the way. So I kind of feel like that was a lining cell. And
I'd
then
probably skip that one, to be honest.
skip it, yeah. So yeah, there's no, yeah, you don't know that it's totally viable, right? So maybe not worth calling. And then this one's kind of tricky for me too. So I think a lot of times this happens more often with, I think, the synovials than anything. There'll be cells where I'm kind of clueless, where I don't know exactly which direction to go. And I don't have great advice except to say, pick a path.
Mm,
So you come to a fork in the road, take it. And so don't waffle on back and forth about one cell.
yeah,
Uh,
yeah, I agree. I mean, these two are both so condensed you could skip them.
yeah, yeah,
If I had to make calls, I could,
yeah,
but they're not like these three are educated calls.
yeah, yeah, yeah.
These two I'd
Difficult
have,
but educated. I like
yeah,
that.
and these two I would have to be like, well, it's squished, but I guess it has these characteristics, so I guess it's in this. So I think these two, because this fluid is cellular enough, we could skip them. And
Yeah,
also I look at these two and I know they're not malignant. I know they're not a problem. I just can't tell if it's a lymph, a mono, or a lining cell.
yeah. Yep. Yeah, so this will come up. Don't be frustrated. Even experienced people kind of deal with this, and I don't think experienced people speak up enough. I'm glad that we're out here on the internet, on the record, exposing ourselves. But yeah, this, somewhat subjective.
We have to look at this guy too. Let's look at that. Big and fluffy and gorgeous.
That is a beautiful macrophage.
But
Yep.
that's it. It's a macrophage. So you have a nice lining cell right next to a nice
Yep.
macrophage.
Yep. Yep. And then a nice so this one's kind of like borderline, right? So like I kind of feel like mono, right? What do you think about that cell? Do you think it might be lymphoid? Yeah. So that's an interesting cell. So I think the biggest clue is the NC ratio there.
Also, the cytoplasm is empty.
True.
The
True.
cytoplasm is empty. Yeah, the chromatin pattern is different from both.
Hmm.
It's closer to this one if I had to pick one than it is
But
that
like
one.
I feel it in my bones that this is a hematological cell.
Oh yeah. Yep.
But like, so part of me is like, oh, this little indent, right?
Hmm.
um and I started thinking like mono, but the nucleus, the cytoplasm is like really, you know
Limpy.
yeah, really lymphy.
It's very
Yeah,
limpy. But it's weird because he's all spread out and you can see the
yeah.
nucleoli. Again, it's just the cytospin that he looks all nice and spread out.
So someone should mark this. I'm having trouble telling a lymph from a mono. I'm regressing.
No, it's a body fluid.
Body fluids are tricky.
Yeah, body fluids are tricky. Oh, we're gonna make the most.
Yeah, so I feel more comfortable now that it's lymphoid, seeing some of these cells.
Yeah.
But I do think that we have two good lining cells here. Um, to account for the difference in the colors of cytoplasm, one cell could have sloughed off earlier than the other, and I think as like synovial cells get a little older, they start to like lose their coloration. They might get a little bit like bubbly, vacuolated. But yeah,
Could be that, and it could also be this is more becoming more reactive to something, so
true.
it could be
That's
an
true too.
inflammatory process.
Yep.
And then I think the other three here, I think they're just lymphs.
Yeah, I agree. Yep. Yeah, so I might have made a call in the moment and called that a mono, and then came to this field and been like, and then, you know, do that math or not be lazy and hit the negative button, pull it out, plus button.
Yeah, but a call like that, like if you would have called that a mono, it's not going to drastically change the slide.
No, 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 no. And certainly the clinical team's not going to do anything different for the patient.
No.
So,
So I think that's important to note too, is that
mhm.
if it's something like that, that's not going to drastically change it. But if all of a sudden you've counted like 50 of them and then you realize those 50 were supposed to be limbs, that is a big deal and that should be started over. But if you
Yeah,
miscall one cell,
yeah, yeah.
ooh, we're going to ignore the clump, but let's look at
Yeah.
these two cells on the edge of the clump.
Awesome, awesome lining cells, right? They
The
got,
blobbiness is really nice.
yep, it's perfect. So yeah, I'm not keeping count, but the lining cell category is like probably pretty high, right? Like this is a significant amount of the nucleated cells.
Seems like there's a good number of them.
Beautiful. Yep. Absolutely beautiful.
Just trying to play with the fine tune and let people see. I'm
Yeah,
debating.
all these cells have great edges and
They do. They have really nice edges. This one's really, really nice though.
yeah,
These two are less nice. They're still
agreed.
nice, but they are less nice. But they don't look like I was debating if they were monos, but I don't.
The thought crossed my mind, but I think the my lizard brain is still hitting lining cell, I think.
Yeah, and I think it's because they're not as like fluffy, large as the cytoplasm is for a lot of the other macrophages that we've seen.
Mm-hmm, mm-hmm. Yeah, so again, you're taking information from the slide and applying it,
Yeah.
right? Is there reactive lymph in there, or
It looks like one, and I think that helps to lend some credence or like to lend some weight to that there could be some kind of reactive inflammatory process happening.
yep, 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 yep. Yeah, so that's a great transition here, right? So I think the pathophysiology that comes to mind is like an autoimmune arthritic kind of situation, which
Mhm.
this is a very common picture. You
Yep.
see lining cells and monomax and stuff. Yeah. So someone can have that rheumatoid arthritis effusion, they pull the fluid and then yep, it's just inflammatory with no indication of infection. Yeah.
Yeah, so this is that reactive lymph that we were just talking about.
Yeah. Cool.
All right, so why don't we? I'm trying to get them in the field, and it's like, "Meh, meh."
It's tough being the driver.
Why don't we end with this field here?
Yeah. So it's a little That one in the middle has got like a lot of cytoplasm, but their proximity and similarities, I think, outweigh that one difference. So I feel compelled to say lining cells. They're also suspiciously like attached.
The windows.
Yeah, yeah, exactly.
The
Yep,
windows are really nice in between them.
yep.
Mhm.
So
Oh, I think this was a good one for seeing lining cells.
it's an excellent teaching slide. Yep.
All right, well, I think that's all we have for this slide, so thanks for watching.
Yeah, thank you for your time.